No, this is a very interesting CT scan of the chest. And what we can see, you can simply pause the video and you can try to find out what is the problem in this particular CT scan. Now, when we zoom in into this picture, what we can see is the lung parenchyma overall in all the lung fields, including any, you pick any lung field, you can see a very small, typical mottling, which is seen in bilateral lung field. So what we can see is there are numerous hyperdense dot like structures which are dispersed in both the lung fields. You can see there are hyperdense, very small miliary. Miliary means like very small grains like jawar. So, and this type of millet shaped or small rounded shaped hyperdense lesions are seen in bilateral lung field, and they are almost uniform, they are almost of same size, and they are of around 3 to 4 millimeter size. Now if you want to appreciate this very well, you can see we can see some other CT scan as well. For example, we can see this CT scan where uh, when we try to see, this CT scan is more of, it does not show that type of extensive miliary mottling. So here when we see this miliary mottling is not at all there. There you hardly can see 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So these are basically bronchovascular markings, which is a very typical normal structure which is present in both the lung field, because there is division of all these bronchial arteries, bronchial vessels, bronchial veins, pulmonary veins. And so these are all the typical normal branching pattern which is there in bilateral lung field. So here we can see that the miliary mottling is not at all there. In the periphery, there is not any miliary mottling, but in here we can very nicely make out that there is extensive kind of starry sky appearance. There are so many small millet size, millet shaped structures. This is a very typical HRCT finding of miliary tuberculosis. And miliary tuberculosis is usually almost always hematogenous spread, and most of the time patients do usually have a very close family history or very close history of someone dying of TB or someone having TB for so many years or so many months, and patient may have fever, weight loss, and all the other symptoms related to TB. This can be definitely treated, but one of the most important thing that we need to understand is while treating such TB, when we start anti-tubercular drugs, patient may have SIRS, patient may land up in systemic inflammatory response syndrome, patients may have fever, weakness, tiredness, cough, shortness of breath, which may markedly worsen, and patients may need steroid for some duration to curtail down the symptoms. This is the X-ray of the same patient where we can see there are very typical or very unique mottling. You can see that mottling is present in both bilateral lung fields. We can see very small, rounded, hyperdense lesion, which again suggest miliary tuberculosis. So that's all for today, and thank you.